Hello and welcome to my presentation for Exercise Science 679 Assessment Task 1. This presentation focuses on my client Mandy and how her condition of metabolic syndrome can be managed and improved through clinical exercise therapy. My name is David O'Neill, student number S00259401. My client Mandy is a 54-year-old woman who was referred by her physician for an initial exercise physiology consultation to help her manage her metabolic syndrome and reduce her risk of developing cardiovascular disease. She has a positive family history of heart disease as her father had a non-fatal myocardial infarction at age 55, which puts Mandy at an increased risk of developing cardiovascular disease. She also has an additional diagnosis of depression, for which she is currently taking 50 milligrams of sertraline per day. As well as this, she has been taking 20 milligrams of Lipitor per day for the previous 6 months to lower her cholesterol, and has also been taking 500 milligrams of Avapro per day to control her blood pressure. Mandy is completely sedentary at work and at home, with no history of physical activity or exercise participation for at least 5 years. This has strongly influenced her body composition, resulting in obesity and muscular atrophy, making it difficult for her to complete her activities of daily living. This accumulation of adipose tissue and deterioration of muscle mass is further demonstrated as Mandy reports general muscle aches in her body when she performs certain activities of daily living, including hanging clothes on the line and walking upstairs. This is most likely the result of her sedentary lifestyle that has resulted in excess adipose tissue accumulation and deterioration of muscle mass, causing weakness, poor endurance, and therefore difficulties with these activities. Mandy is also a regular smoker who is not interested in quitting. This will further increase her risk of developing cardiovascular disease and other conditions such as cancer, while further limiting her ability to complete her activities of daily living due to a lack of respiratory fitness. She reports that there are days where she doesn't feel like getting out of bed, which can be attributed to her depression, which may be the result of her sedentary lifestyle. The metabolic syndrome is a collective term to describe a condition made up of 5 factors. These factors include elevated waist circumference or visceral obesity, elevated triglycerides, reduced HDL cholesterol, elevated blood pressure or hypertension, and elevated fasting glucose or insulin resistance. According to the International Diabetes Federation, if an individual exhibits 3 or more of these factors, they meet the criteria to be diagnosed with the metabolic syndrome. Due to rises in obesity, poor eating habits, and sedentary lifestyles, there has been a rise in the incidence of metabolic syndrome. In Australia, it is estimated that 27.3% of the population may be affected. If left unmanaged, the metabolic syndrome may result in the progression of other diseases. These include type 2 diabetes due to chronic high blood sugar levels, cardiovascular diseases, which include an increased risk of heart disease, stroke, and atherosclerosis, and also non-alcoholic fatty liver disease, which may progress to cirrhosis or liver cancer due to fat accumulation in the liver. Complications of this disease progression include an increased risk of mortality due to factors such as heart attacks, strokes, or liver failure, decreased quality of life, neuropathy and retinopathy, chronic kidney disease, atherosclerosis, coronary artery disease, myocardial infarction and stroke, cirrhosis, and liver cancer. In Mandy's case, her results show the following: a high waist circumference of 115 centimeters, which is above the 88 centimeter criteria for women for metabolic syndrome, a low HDL cholesterol amount of 0.8 millimoles per liter, which is below the criteria of 1.3 millimoles per liter, a second factor for metabolic syndrome, elevated blood pressure of 140 over 90 millimeters of mercury, which is above the criteria of 130 over 85, a third factor, and elevated fasting glucose of 6.5 millimoles per liter, which is above the criteria of 5.5, a fourth factor. Mandy's triglyceride levels were not in her results, however, as she still scored 4 out of 5 on the factors for metabolic syndrome, the result is a diagnosis of the metabolic syndrome. Mandy's results indicate a high BMI and very poor VO2 peak. These factors will directly affect Mandy's ability to perform exercise. Her high BMI will result in her having to work harder at a given intensity as she is carrying a large amount of excess body weight, placing additional stress on her musculoskeletal and cardiorespiratory systems. Her poor VO2 peak indicates a lack of cardiorespiratory fitness, which dictates the intensity she will be able to perform workout during her sessions, as her body can only utilize a low amount of oxygen. Due to her high BMI and poor VO2 peak, her workouts will mainly be at a low intensity, as compared to the intensities attainable by the general population. As Mandy has stage 2 hypertension and an elevated fasting glucose, it will be important to monitor her blood pressure and blood glucose levels during and after training. As Mandy has depression, it will be important to check in with her regarding her mood prior to starting exercise, during the workout, and after. She may benefit from additional encouragement and motivation during the session that can be provided verbally with phrases like, "Keep up the great work, Mandy, you're doing great," and physically with gestures like a thumbs up and a high five. Other measures to be monitored include heart rate and oxygen saturation, which should be taken pre, during, and post-exercise. There are various contraindications that need to be considered before starting exercise. Absolute contraindications include uncontrolled hypertension, unstable angina, recent myocardial infarction, and an uncontrolled arrhythmia. Relative contraindications include controlled hypertension, controlled diabetes, obesity-related joint or musculoskeletal issues, and peripheral artery disease. Mandy is presented with 3 specific goals. These include reducing cardiovascular disease risk factors, improving her weight, and improving her mood. To achieve these goals, I've set 6 goals for her. These are to reduce her waist circumference by 3 to 5 centimeters to 112 to 110 centimeters, which will translate to a long-term goal of reducing her waist circumference to below 88 centimeters. Rahimi et al. Performed an 8-week intervention combining cardiovascular and resistance training, which showed significant reductions in waist circumference in overweight or obese women. In this study, participants engaged in moderate intensity exercises, cardiovascular and resistance in nature, 3 times a week for 8 weeks. By the end of the intervention, the women experienced measurable improvements, including reductions in waist circumference, body weight, and other metabolic risk factors. These results demonstrate that consistent combined cardiovascular and resistance training can lead to waist circumference reductions, often in the range of 3 to 5 centimeters over 8 weeks. The second goal is to increase HDL cholesterol to 1.3 millimoles per liter. Kadama et al. Performed a meta-analysis which had an inclusion criteria of exercise programs of 8 weeks. They found that HDL cholesterol increased by 0.065 millimoles per liter when aerobic exercise was performed at 65% of maximal aerobic capacity for 40 minutes, 3 to 4 times per week. The third goal is to reduce blood pressure by 6 millimeters of mercury systolic and 4 millimeters of mercury diastolic to 134 over 86 millimeters of mercury, which translates to a long-term goal of reducing blood pressure to 120 over 80 millimeters of mercury. Lopez et al. Found that after 12 weeks of moderate intensity aerobic exercise at 50 to 65% of heart rate reserve, participants with resistant hypertension experienced significant reductions in blood pressure. Systolic blood pressure was reduced by an average of 10 millimeters of mercury, while diastolic blood pressure decreased on average by 5.7 millimeters of mercury. As my program that will be implemented is for 8 weeks, or 66% of the duration of these results, it is expected that blood pressure will potentially reduce by 6 millimeters of mercury systolic and 4 millimeters of mercury diastolic. The fourth goal is to reduce fasting glucose by 10% to 5.84 millimoles per liter, which translates to a long-term goal of reducing fasting glucose to between 4 and 5.5 millimoles per liter. A study published by Figueroa et al. Demonstrated the effectiveness of combined resistance and aerobic training in reducing fasting glucose levels among overweight and obese individuals. This 8-week randomized controlled trial involved adults aged 45 to 74 years who exercised 3 times per week for 60 minutes per session. The combined exercise group showed significant improvements in fasting blood glucose compared to the control and single-mode exercise groups. Fasting blood glucose levels were significantly reduced by approximately 10% after the 8-week intervention. The fifth goal is to improve Mandy's ability to complete her activities of daily living. Exercise significantly improves the ability to perform activities of daily living in obese populations. A systematic review by Wiwigi et al. Demonstrated that combining exercise training consisting of aerobic and resistance exercises with dietary modifications leads to improvements in muscle strength, endurance, and overall physical function in obese individuals. These improvements enhance the capacity to carry out daily activities like walking, climbing stairs, and household chores, which are often impaired due to excess weight and reduced fitness levels in obese individuals. The final goal is to increase Mandy's quality of life. Pletikoskik and Ramirez et al. Demonstrated that an 8-week physical exercise program encompassing elements of strength and endurance significantly improved the quality of life in overweight and obese individuals. The program led to substantial improvements in different aspects of quality of life as measured by the World Health Organization Quality of Life Questionnaire. Participants showed notable increases in scores related to overall quality of life, including physical and psychological health and social relationships. There are various barriers and enablers for Mandy achieving her goals. Barriers include that she is a regular smoker, has days where she doesn't feel like getting out of bed, has a high BMI, and a low VO2 peak. Enablers include that she's happy to attend the clinic up to 3 days per week in the early morning, happy to exercise at home, and has a set of light resistance bands and a Swiss ball. Additional tests will be completed in order to assess Mandy's ability to complete her activities of daily living and also her quality of life. These include a 6-minute walk test, which will assess endurance and functionality, time to complete 5 sit-to-stands, which will assess lower body functionality, a World Health Organization quality of life questionnaire, which will assess quality of life, and a grip strength test, which will assess upper limb functionality. The Exercise Medicine Australia professional fact sheet for metabolic syndrome and exercise states that individuals should target 150 to 300 minutes per week of moderate intensity aerobic exercise, such as brisk walking, cycling, or swimming. Exercise should be undertaken at a moderate intensity of 55 to 69% of heart rate max, or rating of perceived exertion 3 to 4 out of 10. Alternatively, 75 to 150 minutes of vigorous intensity exercise could be performed, or an equivalent combination of both moderate and vigorous intensity exercise. To complement aerobic exercise, 2 to 3 resistance training sessions each week can be undertaken, involving 2 to 4 sets of exercises at a moderate to vigorous intensity, equivalent to 70 to 85% of 1 repetition maximum, each for 8 to 12 repetitions. Mandy's exercise program will take place over 8 weeks. It will initially begin with 2 clinic sessions and 2 home sessions of 40 minutes each in duration per week, totaling 160 minutes of activity each week. The program will see a gradual increase in volume over the 8 weeks, with sessions gradually increasing by 5 minutes. This increase will be in the form of extra repetitions and extra sets. In the 5th week, there is an addition of a 5th day of training, which is purely aerobic in nature, a walk, to boost her weekly aerobic activity. The weekly training volume reaches 275 minutes per week by week 8, with each session consisting of 60 minutes, a 20-minute increase per session from week 1, as well as a 35-minute purely aerobic session. Mandy's exercise program was made following the metabolic syndrome exercise guidelines while also factoring in her current fitness level. It would be unrealistic to begin with 150 to 300 minutes of aerobic activity per week, given her current level of deconditioning, so we would have to work up to this over the course of the 8 weeks. The sessions are formatted to have a warm-up, 3 clusters of combined resistance and aerobic exercise, an aerobic component, and a cool-down. The program utilizes clusters to combine resistance-based and aerobic activity. For example, Cluster 1 features a sit-to-stand, standing push-up, dumbbell bicep curl, and a 100-meter walk. This format has been used for practicality and will challenge Mandy's musculoskeletal and cardiorespiratory systems, leading to adaptations such as an increased ability to complete activities of daily living, reductions in weight, and improvements in other metabolic markers, in line with their goals. Progression can be seen from week 1 to week 8 in various elements of the session. These include an increase in sets from 2 to 3, an increase in reps from 8 to 10, and the inclusion of more challenging exercises such as replacing a sit-to-stand with a goblet squat and a rack pull with a deadlift. The program is consistent with the various sources listed in the goals section of this presentation, as it features a combination of cardiovascular and resistance training in the intensities that are recommended to achieve Mandy's goals. Mandy's home exercise program consists of the same format as the clinic sessions, a warm-up, 3 clusters, an aerobic component, and a cool-down. Clusters in the home program are designed to include exercises that are performed on the floor and standing, which will encourage additional movement as Mandy will have to get up and down from the floor. The program is in adherence with the metabolic syndrome exercise guidelines and other literature listed in the goals section of this presentation, and will contribute to the achievement of Mandy's goals. Progression can be seen in the increase in sets, reps, and total aerobic activity. Michi et al. Found that behavior change interventions designed to promote physical activity are effective, with an overall effect size of 0.31, showing a small to moderate but significant effect. Interventions that included self-monitoring and at least one other self-regulation technique were significantly more effective. Therefore, Mandy and the exercise professionals that she is working with should adhere to the behavior change techniques of self-monitoring, prompting intention formation, specific goal setting, providing feedback on performance, and reviewing behavioral goals in order to enhance adherence to exercise. Sociocultural, psychological, and economic considerations include attitude towards exercise, health literacy and awareness, social support, access to good nutrition, access to other health professionals, transportation barriers, and the cost of seeing an EP. It is the exercise physiologist's duty to provide education and recommendations such as seeing a dietitian to improve weight loss and completing home workouts with a friend at the park to ensure that Mandy adheres to her exercise prescription and achieves her goals. Here are my references. Thank you for your time.